Guys, what if I told you that millions of men over 60 are throwing away hundreds of dollars on performance pills and treatments while the solution is sitting in their bathroom drawer, probably worth about 50 bucks? You probably walked past it this morning. It's designed to vibrate. It's designed for precision. And it creates the exact frequency needed to reactivate nerve pathways that control erections. But 99% of men have no idea. I'm talking about something you already own, something that's been engineered for years to deliver consistent vibration therapy. Medical device companies charge thousands for vibration therapy equipment, but you've had the same technology sitting in your bathroom this whole time. I'm Dr. Amara Cruz. I've been working in men's health for 14 years, and when I realized that men were spending fortunes on expensive treatments while ignoring this simple device they already owned, I knew I had to share this. The technique takes 30 seconds. It costs you nothing. And it works because most men have never understood the real potential of the devices they use every day. We haven't analyzed in a long time who's watching from where. So, let me know in the comments. Seeing your support from all around the world really motivates me. Now, hit that subscribe button so you don't miss this technique and the ones coming next. All right, let's begin. So, what exactly is this device and why is it so powerful for erectile function? Your electric razor creates vibrations at 7,000 to 10,000 vibrations per minute. This isn't random buzzing. It's precisely engineered oscillation. This exact frequency range is optimal for nerve pathway activation. The pressure point I'm about to show you is called the perineum. It's the area between your testicles and your anus. Most men ignore this spot completely, but it sits directly above some of the most important structures for erectile function. Right beneath this area lies your bulbospongiosus muscle, the muscle that traps blood in your penis during erections. Also beneath this point is the pudendal nerve, which carries electrical signals between your brain and your erectile tissue. When this area becomes dormant, which happens to most men over 60, these crucial structures stop working optimally. Blood flow decreases. Nerve signals weaken. Morning erections fade. But when you apply targeted vibration to this exact spot, you can reactivate these dormant pathways. The vibration stimulates the pudendal nerve, increases blood flow to the muscle, and essentially wakes up the entire system. Now, here's the technique. And listen very carefully, because getting the position and timing exactly right makes all the difference. First, you need privacy and comfort. This works best when you're relaxed, either sitting on the edge of your bed or standing comfortably. Take your electric razor, make sure it's clean, and turn it on. You want full vibration power, not the gentle setting. Now, locate your perineum. Place one finger halfway between your testicles and your anus. Feel for a slight depression. That's your target area. Here comes the key part. You're going to apply the back or side of your electric razor to this spot, not the cutting head. Use the smooth back portion. The vibration should transfer through the casing. Apply gentle but firm pressure. You want to feel the vibration penetrating into the tissue, but this shouldn't be painful. Just steady, consistent pressure with the full vibration frequency. Hold this position for exactly 30 seconds. The vibration needs this full duration to effectively stimulate the nerve pathways. During these 30 seconds, you might notice a tingling sensation, warmth, or even a slight pulsing feeling in your pelvic region. This is completely normal. It means the vibration is reaching the right structures. After 30 seconds, turn off the razor and remove it. Many men report feeling more awake or activated in that region immediately after. That's it. 30 seconds of targeted vibration therapy using a device you already own. Now, what's happening biologically during those 30 seconds? The vibration is stimulating mechanoreceptors in your perineum, specialized nerve endings that respond to mechanical pressure and vibration. When these receptors activate, they send signals along the pudendal nerve pathway directly to your spinal cord and brain. This nerve stimulation triggers increased blood flow to your pelvic region. Your bulbospongiosus muscle receives better circulation. The entire erectile system gets a wake-up call that it may not have received in months or years. Additionally, the vibration helps reduce muscle tension in your pelvic floor. Chronic tension in this area, common in men who sit frequently or experience stress, can restrict blood flow and nerve function. The targeted vibration helps release this tension. Let me give you realistic expectations, because results build gradually. In the first 24 to 48 hours, you'll notice increased awareness in your pelvic region. You might feel slight tingling or warmth that wasn't there before. Days 3 to 5, morning erections often start returning. Maybe not full hardness yet, but you'll notice partial firmness upon waking. This is your erectile system beginning to reactivate. Week 1 to 2, morning erections become more consistent and firmer. You may also notice faster arousal during intimate moments. Blood flow is improving and nerve sensitivity is increasing. Week 3 to 4, most men report significant improvements. Fuller morning erections, better performance, increased confidence. The daily stimulation has effectively retrained your erectile system, but consistency is absolutely crucial. Your nerve pathways need daily activation to maintain optimal function. Do this once every day, preferably at the same time. Inconsistent daily practice ruins everything. You try it for 3 days, skip 4 days, try it once more, then quit. But nerve reactivation requires consistent daily input. Missing days resets your progress. Finally, expecting instant results leads to disappointment. You try this once, don't immediately see changes, and conclude it doesn't work. But you're retraining nerve pathways that may have been dormant for years. Here's your challenge. Use this technique every single day for 14 days. Just 14 days. 30 seconds each day, same time, same technique. Days 1 through 3, focus on getting comfortable with the technique and finding the exact right spot. Days 4 through 7, start noticing changes. Increased pelvic awareness, possibly some morning firmness. Days 8 through 14, evaluate your progress. Most men see clear improvements by day 14. If this technique helped you understand how simple tools can create powerful results, hit that like button and subscribe. Drop a comment with 3 words. I'm trying this. I read every comment, and I want to see who's committed to giving this a real test. I'm Dr. Amara Cruz. Your erectile function isn't gone. It just needs the right kind of activation. 30 seconds a day with a device you already own. That's all it takes to start reactivating what's been dormant. Thanks for watching, and remember, the solution might be simpler than you think.